Of preemptive use of non-steroidal anti-inflammatory drug and the corticosteroid and efficacy of inferior alveolar nerve blockade and post-operative pain control and endodontic treatment of molars with symptomatic pulpitis. Randomized, double-blind, placebo-controlled clinical trial. Rodrigues et al. And was published in the International Endodontic Journal 2024, January 10th. This was a Brazilian group um, containing professors from different universities of Brazil. We all know the challenge in relation to inferior alveolar block with patients with symptomatic pulpitis. This study aimed to evaluate the influence of uh, preemptive use of dexamethasone and oral potassium diclofenac on the success of inferior alveolar nerve block. And the influence of these drugs on the intensity of post-operative pain was assessed as a secondary outcome. Going through the methodology, they had 84 patients with mandibular molars diagnosed with irreversible pulpitis, symptomatic pulpitis, and the pre-operative pain intensity was recorded with a numeric rating scale in addition to cold test. And 60 minutes before the anesthetic procedure, patients were randomly assigned to one of three groups, either dexamethasone or diclofenac potassium 50 mg or placebo. All patients received the block 4% articaine, 1 to 200 epinephrine. Then there was an analysis to the success of the anesthetic, and the pain intensity was recorded. It was monitored. The patients were monitored for 6, 12, 24, 48, and 72 hours using the numeric scale. Going through the results, there was a significant increase in the anesthetic success when 4 mg dexamethasone or 50 mg diclofenac potassium was used compared to the placebo group, but there was no significant difference between both groups or both drugs. Regarding post-operative pain, dexamethasone was superior to placebo, diclofenac having an intermediate behavior, not differing between dexamethasone and placebo. Analyzing these results, the use of dexamethasone 4 mg or the 50 mg of diclofenac potassium was administered orally 1 hour before the procedure, and this corroborated with systematic reviews and meta-analysis suggests that there is an influence of both NSAIDs and corticosteroids in anesthetic success while inferior alveolar nerve block. So it also simulated or it demonstrated decrease in pain intensity 6 hours post-operatively compared to the placebo group. So it could be interesting, the use of dexamethasone or diclofenac potassium in the inferior nerve block in patients with irreversible pulpitis. It's an interesting multi-center study, large sample size. This would be very interesting to validate the results of this study as it could be seen in different populations. Thank you for listening.